Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Markham.
Welcome, welcome, welcome. We're glad you've joined us today on Heart of Health Live, where your questions can be answered. We have a very exciting program today to tell you about and to share with you. And if you have some friends that this might apply to, I want you to call them into the room and start talking. We have Dr. Wendy Halsey-Richardson with us. She's an audiologist, but that's a big word that means helps you hear better. So if you're having a problem hearing me, you might want to turn it up and listen to this program for sure. I didn't realize it, but let me share some interesting statistics with you. Did you know that 12% of people, or about 38 million people, have significant hearing loss? 30 to 40% of all people over 65 have problems with their hearing as well. It not only affects the old, it also affects the young as well, as 14% of people between 45 to 64 have hearing loss. That sort of hits my age group. It not only affects those, but those between the ages of 6 and 19, 15% of those have some hearing problem. We also have 3 million children in the United States that have hearing problems, and 5 in 1,000 newborns have some type of hearing problems. And out of chronic disease, hearing loss is considered one of the top 3 chronic diseases that we have in America. You know, other chronic disease we've talked about, arthritis, chronic pain. Well, hearing loss is right up there with them. So it's something that we need to know. We also know that noise is a contributor. We know that people wait before they get help, and we don't want you to wait anymore if you have help. We know that people sometimes wait up to 7 years before they get help with their hearing. So if you have a question today for Dr. Halsey-Richardson, we want you to give us a call at 855-644-3278. We have 2 on the phone already. We're going to be with you after this short intermission. Don't go away. If you can't hear, turn up the dial. This might help you to have a better hearing experience. Stay with us.
The Heart of Health Live will return in just a moment.
The Heart of Health Live is brought to you by Heartwise Ministries.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't, because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's 1 every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. We're glad if you just joined us. We're glad you're with us. We're talking about hearing, and if you have a question regarding hearing loss, hearing aids, infections, all sorts of things, we're going to talk to Dr. Halsey-Richardson this evening. She's agreed to be on with us. And before we do that, let me give you the number again. It's 855-644-3278. You can also go to our website. That's heartwiseministries.org and leave your questions there. If you're too shy to come on the air live, you can just leave your questions and our call center will bring them to me between breaks. Also, if you'd like to be one of our Facebook friends, you can friend us on Facebook as well. In fact, the winner of our Facebook drawing for this book that I just finished writing, and it's just on the presses, it's Medicines That Kill, and we had a drawing for that recently, and the person that won that drawing was Annette Michaels. So Annette Michaels, thanks for passing this on Facebook. We're going to be sending you a copy of this book in the mail very shortly. And we hope you enjoy it and realize that the #1 cause of death in America, in this book, I try to prove that it's medications. So I hope you enjoy that. And thanks for passing on the ministry to your friends. Dr. Halsey-Richardson, I'm going to call you Wendy.
Perfect.
Because that hyphenated name is pretty big.
It's a lot to say.
So I guess that means were you Halsey first or Richardson first?
Halsey first.
You're Halsey first, and then I guess you married a Richardson.
That's right.
Okay, and I hope you just stay that, because then you won't have to be Halsey-Richardson something else.
We're not changing.
I bet you have to write a little bit when you have time.
Yeah, it gets, sometimes I question my decision.
Well, how did you get interested in hearing?
Well, my grandfather had hearing loss, and he wore hearing aids. He wore the old-timey eyeglass hearing aids, so it was connected to his glasses and behind his ear. Unfortunately, this was, 30 years ago. And even with that, he had trouble hearing. But that was my introduction to hearing loss and hearing aids. So when I was looking for a career, it came across the desk as a possibility, and here I am.
Well, tell me, do you have to go to school for this, or you just sort of pick it up on your own?
Yeah, absolutely. When I went through, it was a little different now. Okay. You had 4 years of undergraduate in audiology, a master's degree in audiology, and then 2 more years for your doctorate degree.
Wow.
So you do.
Spend a lot of years in school learning about this. But if you're like me, I learned more after I got out of school
Absolutely.
than I did in school.
On the job.
It's like an on-the-job you're learning every day.
Right.
Well, let's get to our first question, and this comes from our website. And it says, my hearing is getting worse. Where should I go for help? So Wendy, if someone doesn't think they're hearing good, where should they start?
Yeah, well, absolutely. I think they should start by calling an audiologist. It's an easy place. If you're not having drainage from your ear or pain, call an audiologist. You can find one online in the phone book. And that's the best place to start. They'll take a look in your ear, see if you have earwax, a medical issue. They'll test your hearing, talk to you about that, and make recommendations for you. It may be that you have a slight loss and only need to use that as a baseline for the future, but I would start with calling an audiologist. If you have an appointment coming up with your primary care physician, talk to him about it. He can tell you what's a good next step.
I didn't realize this, but only 16% of physicians actually screen for hearing.
I know, and we're working on that.
I screen for hearing because when they come in, I have to really speak up sometimes.
That's right.
And then I remind them, you want to get your ears checked. And for some reason, some people don't like to, mainly the men, they don't want to get their ears checked.
Unfortunately, there's still a little stigma with hearing loss.
Why is that?
I mean, they just link it with aging so often that they think, if I have a hearing aid, I'm admitting that I'm getting older, or I'm admitting that I'm not as sharp as I used to be. And they should not feel that way.
Now, so someone comes to an audiologist and start looking at it. Does it hurt the things you do to them to figure out what's wrong with their hearing?
No, it's all non-invasive. It's easy. They go in a sound booth, sit, answer some questions. We do some speech testing to test your understanding ability for words.
Okay.
Because often folks say, I can hear, but I can't understand. So we test for that. It's very simple, takes about 30, 45 minutes.
Do you look in the ears and
we look
all
in
that
the ears
kind
with
of
an otoscope, see if they have a wax buildup, see if the eardrum looks healthy. If we think they need a referral then to their medical doctor, we make that referral.
Okay. Well, I see that Rose is calling and on the phone. Rose, you're on with Dr. Halsey-Richardson. Go ahead and give us your question or comment. Rose?
Good evening.
Good
Yes.
evening.
The question I have is, I have multiple sclerosis. I've had it since 1976. I was in the military in the 70s. I was a mechanic, worked in a hangar, and we don't know whether some of my hearing loss was due to the mechanic job or from my MS. Now, the problem I have is I've had 3 different sets of hearing aids. And what has happened with each of them is they'll pop out of my ears on occasion because the holes in my ear holes, they fluctuate in size. They'll either shrink down or get a little bit larger, and they say that's because of the MS. What kind of hearing aids could I use or get that, and like those headphone type of things, those are a problem too, because I may be an adult, but I've got this tiny little head that those kind of hearing aid headphones, will not sit on my ears. They sit under my ears.
Okay.
What would you recommend?
Well, hi, Rose. First, let's talk about your hearing loss. I have just a couple of questions. When you were in the military, was it a noisy area in the hangar?
Yes, it was. We were working on equipment and that type of thing. Engines running and that. I used to wear earplugs a lot.
Mm-hmm.
Rose, how old are you?
I'm 60.
Okay. How long have you been had the MS diagnosis?
Since 1976.
Okay.
I got it.
What type of hearing aids have you tried in the past? Were they small ones that fit all the way in your ear, or were they behind your ear?
In the ear.
In the ear.
Yes, and then I've got to be real careful that certain things, I'm allergic to a lot of stuff.
Okay.
If they're made out, if there's petroleum in it, I will have an allergic reaction. If it's even any rubber or anything like that, allergic reaction.
Rose, it sounds like if you're having a lot of movement of the ear canal, especially with chewing or even talking, it can pop those in-the-ear hearing aids out. I would probably suggest first that you talk with your audiologist, but try to move the hearing aid out of the ear canal, get most of those working parts behind your ear, and only have a small wire, a little open receiver in the ear, and you don't have to worry about it popping out. They're called receiver in the canals.
Okay.
Okay. Well,
okay, that sounds very good.
Yeah. Well, Rose.
In other words, you're talking about those ones that kind of clip on. They kind of look like a Bluetooth, but they're behind the ear, right?
Yeah. It's small. About the size of your fingernail. Fits behind the ear. It can be nice and hidden. Like for me with my hair, you wouldn't see it at all. Very small. You can even give us a call. I can mail you some information.
Okay, what number would I call?
Well, yeah.
I think they're going to put it up.
Yeah.
I can tell you. I think they're going to put it up. It's 423-648.
423.
648.
4232.
4232. 648 4232.
4232. Thank you, ma'am.
Absolutely.
I appreciate it.
And Rose, they also have a website if you're computer inclined, and it's Chattanooga Healthy Hearing.
Yes.
.com.
Healthy.
Chattanooga HealthyHearing.com. Well, thank you for your call, Rose.
You.
Boy,
Thank you.
we have a lot of calls coming in, and after our break, we're going to get to Rose in Georgia. We want you to stay with us and learn a lot about hearing with Dr. Halsey-Richardson. We hope everyone's learning a lot. Stay with us. We're going to talk more about hearing, which is a very common problem that all of us might suffer from someday. We'll be right back.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said, or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We're glad you joined us, and we hope you, even if you don't have a question, we hope you're learning something about your hearing so you might apply this to your life. And if you don't have your hearing, you miss out on a lot of good things in life. You can't hear the birds, you can't hear all sorts of things. So we're glad you joined us, and we hope you're learning something. At Heartwise, we're here to serve you. We're not trying to make money. Dr. Halsey-Richardson's not getting paid. There's no devices here. We just want to give you good information and help serve you. Because when we serve each other, it helps our chemistry. So we want everyone to serve. With that in mind, Rosa, you're on with Dr. Halsey-Richardson. Go ahead.
Oh, thank you. I have problems with my ears, and they feel like there's pressure behind the ear drum. And it feels like it's getting ready to rupture, and I get these sores in my ears, and they itch, and they itch real bad. And then they turn into blisters, and they bust, and it feels like the eardrum is busted.
Rosa, have you talked to your doctor about this at all?
Yeah, but he looks at them, and he just tells me the sores are in there, and then he gives me these ear drops. And he gives me these ear drops, but they don't help. And then he tells me, because I have gluten too, and I didn't know if that was causing, something might have to be caused by the gluten.
Well, it sounds like, you could be sensitive to lots of chemicals in the environment. Are you, what you may want to do is, talk to your physician, make sure he understands the condition that you have. And, you can always also see an audiologist, let him look in the ear. Sometimes a second opinion is a good thing to have. We can take a look, see what's going on in that ear canal with your eardrum. It's kind of hard to diagnose from here, but I would say see someone. It sounds like you need to have it looked at.
Yeah, because it gets so bad the lymph nodes is swelled up in the back of my neck.
Yeah. Rosa, the lymph node swelling, that sounds like an infectious process. Yeah, you might have some type of infection that you might need that treated as well. So go get some help, Rosa. We don't want this if it is an infection, we don't want it to spread. And we want to thank you for calling. And don't be too shy to get a second opinion.
Exactly.
And a lot of people go to more than one store for their groceries. So it's okay to go to more than one doctor because everyone has different sets of skills.
Okay. Can I get him to send me to y'all?
Well, I don't know, but you can give the phone number a call and they can see if they can get you in.
Okay, is that number that's on the screen? It says live at 855-644-32.
If you call that number, we'll give you the number that we can get you a hold of Dr. Halsey-Richardson, okay?
Okay.
Thank you for calling, Rosa.
All right, bye, and thank you.
Okay. Well, that's very interesting. You know, it's always good to get second opinions about things.
Absolutely.
You know, because, you know, like some people are good at some things and other doctors are good at other things. If a person came to me as a heart doctor with a hearing problem, you know, all I know to do is what I do is I put my stethoscope in their ears and I yell, "Are you having chest pain?" And they can usually hear me when that happens. And then I say, "Would you like to get some more help?" Okay, Susan, you're on with Dr. Halsey-Richardson. Go ahead.
Hi, my name is actually Sue.
Okay.
And I'm calling because I just happened to catch you on TV. I've never seen you on before, so I'm real glad I did.
Okay.
My husband is having a problem with his hearing. And it's particularly difficult because I have exceptional hearing. I mean, I can hear him if he comes in the back door and I'm at the other end of the house. I can hear everything. And he doesn't hear me when I'm standing behind calling his name. So I've been trying to get him to go and see a hearing doctor. I recently had my ears checked because I was having a problem with my ears. I wish I had waited a little bit and said, well, how about if I make one for both of us, make an appointment for both of us? But I didn't do that. Excuse me. But
are you okay, Susan?
Sorry.
Are you okay?
I should have called about my throat.
Yeah, sounds like it. What's your question, Susan?
Pardon? I didn't hear you.
What's your question?
I want to know how to get my husband to the doctor.
Okay. I bet you hear that one before.
Yeah, and Sue, that's common. If we could just, drag the husbands in, but, really talk with him. If you have children, have them talk with them about what he's missing every day and really about how it affects the whole family, his not hearing. And if that doesn't work, unfortunately you were tested already, but maybe agree to go with him and have yours tested again. Sometimes that takes the pressure off of him a little. If you're both going in and he's going to see the results of both. Also let him know, I'm not sure if he's working or not working, but
no, he's retired.
He's retired. There's some things like dementia and Alzheimer's. The onset is sooner if you have undetected hearing loss, so you should have it detected and treated. So if you have to, go that far, use that because that's true.
Right.
Oh, I would, because my parents and his father both passed with that.
Well,
so that would be a real good way to do it.
Yeah, just try that.
Absolutely, and let him know how easy it was. You had yours tested. There's no pressure. Especially if you see an audiologist, you're not going to get a high sales tactic. Just getting a test.
Yeah.
So.
And Susan, if that doesn't work, you can say, if you don't get your ears tested, I'm not going to make dinner tonight.
Oh, I've already tried that
Oh,
one.
you've already tried that. Okay. Well, listen, we hope that works, and we'll say a prayer that you can get your husband there to hear, because he's missing out on a lot of good stuff. But thank you for your call, Susan.
Thank you, and thank you very much for hearing me out.
Okay, well, thanks, and watch out for that cough, okay?
All right.
We have a question that's come in to our website here, and it says, my ears ring a lot, and I'm sometimes dizzy. Could this be related to hearing?
Well, absolutely. The number one cause of ringing in your ears or tinnitus is hearing loss.
Okay.
So you should start with having a hearing test and see if that could be the cause of your ringing. Now, hearing loss isn't going to cause dizziness, but they can be related.
Right.
The organs in the ear for balance and hearing are very close, so something that's attacking one can be attacking the other. So absolutely.
Now, what are some of the causes of hearing loss? You know, is it just degenerative or infections?
You know,
or?
there are lots of causes. Probably the main cause is aging.
Okay.
I would say the second cause is noise exposure. So folks who work in noise, they're around gunfire, military, music with some of the teenagers. So noise exposure is a big one. Ear infections, medical issues.
Okay.
If you have diabetes, heart disease, your incidence of hearing loss is also higher.
So I guess I should walk around with some headphones
to
protect my ears?
Oh, well,
so I don't hear
yes,
things?
as long as the music's not too loud in the headphones. But no, you don't need that every day, but do protect your hearing. Mowing the lawn, power tools, everyday things that sometimes you don't think about hurting your hearing can be pretty loud.
Well, you know, it's interesting because the eye doctor says we need to wear things to protect our eyes.
Right.
The tooth doctor says we need to protect our teeth. Now we have the hearing doctor says we need to protect our ears. So if I wore all this protection, I don't think people would recognize me. I'm going to have to do that one of these days. One of the things I learned is this can also affect your heart. I mean, your heart can affect your ears.
Right. That's right. There's a link between heart disease and hearing loss.
And that may only make sense because you have to get blood to your ears, and sometimes you can have blockages in the vessels that go to your ears, and if you have that, that can affect the way you hear as well. That's very interesting. Hey, you still have time to give us a call. Our phone number is 855-644-3278. After break, we have Kermit from Pennsylvania that's going to be joining us asking his question. If one person has a question, you might be asking a question that thousands of people have. On Heart of Health Live, stay with us, go get a glass of water, and come right back.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thickened, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in two, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Markham is doing in your area, visit heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. If you're just joining us or channel searching, you don't want to watch the news or anything else, you want to learn about your hearing with audiologist Dr. Halsey-Richardson. And our next caller is calling from Pennsylvania. Kermit, you're on. Go ahead.
Yes, I'm here.
Okay, go ahead.
I have hearing aids inside my ear. It echoes, and the words run together, and I can't make out what they're saying.
Okay.
Hi, Kermit.
Yes?
So tell me, how long have you had your hearing aids?
About a year.
Okay. Have you been back for an adjustment?
Yes. I had them turned down, and it still does it.
Okay, so let me just make sure I understand. It feels like the words run together.
Right.
Right. Well, my guess is that you should go back again. I hate to tell you that, but hearing aids, it's not they're set and they're ready. They require a lot of fine-tuning. Hopefully you're developing a relationship with your audiologist. Are you seeing an audiologist?
Yes. I mean, the people that fitted me the hearing aid, that's all I'm seeing.
Okay. You know, Kermit, find out if you're seeing an audiologist. If not, you may want to find an audiologist because they really specialize in the fine-tuning of that hearing aid. They don't want to just sell you that aid. And it may be that your hearing should be retested. Maybe you've had some changes in your hearing, and the way the hearing aid's programmed is not exactly right for you at this point. Really, it sounds like you need some follow-up and some fine-tuning of the product that you currently have.
Okay.
Well, get it looked at, Kermit. Don't be shy. Go back and say, listen, it doesn't work. You know, if my car wasn't working, I keep taking it back till they got it right. So take that thing in there and get it straightened out.
You say you're audiologist.
Audiologist.
How do you spell that?
It's AUDIOLOG.
Oh, okay.
Okay. Well, thank you for calling, Kermit. We hope you have good weather in Pennsylvania today.
Okay, it's raining.
Okay, you're welcome. Judy, you're on with Dr. Halsey-Richardson. Go ahead.
Hi. I had a question. I cannot hear out of my right ear. I can put the telephone up against my ear and not hear anything at all. And I was wondering, I've had troubles for a long time with a lot of earwax built up in my ears. And I've been to doctors, you know, not a hearing specialist, but to doctors and had them clean the earwax out. Well, they always tell me out of the one ear that I can't hear out of, which is my right one, that I have the earwax is hardened, you know, in my ear, and so they give me earwax softeners to soften it up. Well, that doesn't seem to work. I still, you know, even though I use them, I still cannot hear out of my right ear at all. And I was wondering, do you think I need to see a hearing specialist? And would the earwax cause me to go deaf in that ear?
Yeah, it sounds like two issues really. First, with the earwax, if you're using a softener, the job of the softener isn't to remove the wax, but to soften it so that it can be removed easily. So before you see an ear specialist, I would use the softener so the wax is easy for them to remove. Then you need a hearing test. Once the wax is out of your ear, you need a hearing test to see was the wax causing the hearing loss, or do you have a hearing loss? Also, having a hearing loss on one side is important to see your physician for.
Yeah.
So if that's what I would do. Use the softener, see the ear specialist, probably an ear, nose, and throat specialist. Let them remove that wax, and then test your hearing to see if the wax solved your problem or not.
Okay. All right. Thank you.
You're welcome.
Judy. And that brings up an interesting question. What's the difference between an ear, nose, and throat specialist with what they do and an audiologist? Or do they sort of work together?
Yeah, typically we work together.
Okay.
Often an audiologist will work in the office with an ear, nose, and throat specialist.
Okay.
An ear, nose, and throat specialist obviously is a medical professional, a doctor.
Mm-hmm.
He went to medical school, he can write you a prescription, treat medical issues of your ear. An audiologist is a doctor of audiology now, so I have a doctorate degree in treating hearing problems, but not medical problems of the ear.
Right. So it's very important, I guess, to sort through what's a medical issue and what that is.
Absolutely. If you're pretty sure going in that it's a medical issue, see your ear, nose, and throat specialist or talk to your primary care physician. If it's straight hearing loss, you can always start with the audiologist.
Yeah.
If we see a medical issue,
Then you're
we're going to refer you.
But it sounds like, if you said earlier that the causes of healing are aging and noise.
Right.
So if
That's
you're not
right.
hearing good and you've been aging or having around noise, then that might be starting with you.
Exactly.
And if you have like pus draining out of your ears and lymph node problems, then that means you might want to start with your doctor, ear, nose, throat doctor.
Right.
Okay, well, that's very good information. Teresa, you're on with Dr. Halsey-Richardson. Go ahead.
Yes, I've had tinnitus for probably 20 years, and my physician says there's nothing that can be done for it. I just wondered.
Hi, is it Teresa?
Yes.
Hi, Teresa. Do you have hearing loss as well?
I have a hard time hearing people, and my husband says I keep the TV up way too loud.
The main cause of tinnitus or tinnitus is hearing loss. You should probably have your hearing tested, see if that is probably the cause of the tinnitus or tinnitus. And while there's not a medical cure for tinnitus, there are some things that can be done. There are tinnitus maskers. There's some new therapy called tinnitus retraining therapy that's very helpful for folks who are suffering from noise in their ears. So I would see an audiologist, get a hearing test, and talk to them about what your options are.
Okay, thank you very much.
You're welcome.
What does tinnitus mean? You throw that word around.
Right. Tinnitus just means noise in your ear, and it could be a ring. Some folks say it sounds like crickets. It could even be a roar. So basically, it's just a noise in your ear. One
time I had a little crick in my ear, and I thought it was just water because it went away. Does water ever get in your ear and make noises?
Yeah, absolutely. Anything touching your eardrum could cause your ear to make a noise.
I did this for a while, and it seemed to clear up, but then my head started hurting, so I quit doing that. So if you're hearing funny things in your ears, you might want to get that checked out. Here's a quick question that we've come into our website. How can I tell if my child is hearing? So that's a very good question.
Absolutely. Our rule of thumb is if you think your child is not hearing, get it tested. Okay. In a child, sometimes it's hard to be sure. Parents come in and they say the TV is so loud, and when we turn it down, they say, I cannot hear it. Chances are we test them and they're fine. Yeah. So if you think your child's not hearing, have it tested.
Now, why is that important?
Speech and language development, number one. Speech and language development, it's important that they're hearing. And really, that doesn't start at 3, that starts at 2 months. Yeah. So if you have any question, talk to your doctor, have it tested.
Wendy, I was watching Mr. Holland's Opus not too long ago. I don't know if you saw that movie, but in that movie, he had a child that didn't hear.
Right.
And when they picked that up, then the development just sped up, and it was amazing.
That's right.
After that.
That's right.
How often is congenital problems seen? Is that a very common thing?
Yeah, it's pretty common. Yeah. We seem to still see it a lot, but I think we just diagnose it more now. But genetic issues with hearing loss are still a major cause of hearing loss in children.
Yeah, and according to my fact sheet here, you might agree with this, babies are never too young to have their hearing tested.
Newborns are tested before they leave the hospital.
Okay, well that's great. You still have time to give us a call, 855-644-3278. You can join us on Facebook or go to our website, heartwiseministries.org. We're so glad you join us, and hopefully you're learning something about your ears, and you might get treated and your hearing can improve. That's one of our important senses. Stay with us. We're going to be back after this short break.
The Heart of Health Live will return in just a moment.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
Hi, I'm Dr. James Markham, speaker, director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. We're glad you're sending in your questions. And we can't answer every question, but one thing you can do is go to our website, leave your questions, and we'll have Dr. Halsey-Richardson come in again sometimes, and she can work on these other questions. But let's go to some people that have called in and just left their questions here. This is Ralph, and where's Ralph from? Let me look here in the sheet here. Ralph is calling us from. So Ralph has a slight, has a slight hearing loss. Other than hearing aids, what can Ralph do to help his hearing?
Yeah, Ralph, I'm assuming that you've been tested to know that you have only a slight loss. When you're having a conversation, it's always best to be in the same room, hopefully face-to-face with the person. Using a phone, use a good high-quality phone that has a volume control. You can turn the volume up on the phone. Same thing with cell phones now. Most of them have volume control. Some find it helpful to use the speaker on the phone instead of the regular earpiece to the ear. They seem to hear a little better with the speaker. There are assistive listening devices you could use. A lot of churches have assistive listening devices where you'll borrow their earphones for the service, and then the message is right to the earphone. A lot of theaters have the same assistive listening device, so those are some options for you.
Yeah, and also we want to throw in there, if you'd had vascular hearing problems, you want to improve your vascular system.
Oh, absolutely. Be healthy. Eat healthy. Get regular checkups. If you have diabetes, please try and keep it under control.
Right, so that's a good one. Now, Imogene Lavelle is writing in, and bless her heart, she's 93 years old, but she notices that when sleeping, even on a soft pillow, she has problems with pain, I guess. What can she do to get some relief when you put your ear on a pillow and it hurts?
Absolutely. First, Imogene, I would want to make sure that you don't have a buildup of wax in your ear so that you get a little extra pressure there. So have someone take a peek in your ears, make sure they look open and healthy. And then you may want to mention it to your primary care physician. A lot of folks who have problems with the joint under their ear, the TMJ, that can cause some pain and discomfort with pressure. So that's a couple of ideas for you.
Okay. And we have Bob. Bob writing in and says he and his wife are having problems with words seeming to blur together. So what would you do with that?
One of the top 10 signs of hearing loss is people seem to mumble or their words run together. So it probably means you need to go and have your hearing tested, see where you are, get a baseline, get some recommendations. But that's usually a sign that there's a little hearing loss.
Yeah. Well, I never knew there's such a variety of hearing things. Cindy, you're calling from Louisiana. You're on with Dr. Halsey-Richardson. Go ahead.
Oh, hi. I'm calling. I have an issue. I don't have any hearing loss, but I have where I hear my heartbeat in my ear, or the pulsating of it or something, and it's very aggravating, and it comes and it goes. But here lately I've had it every day, and I'm just wondering, is there something I can do about it?
Well, a couple of things that you'll want to check. Again, have someone look in your ears, make sure you don't have a wax buildup. If you fill up that ear canal with anything, and especially wax, your pulse will just pop right in there. How's your blood pressure? Have your blood pressure checked. High blood pressure, you may be getting a big pulse through that ear and you can hear it. So those are the things I would do. Talk to your primary care physician and go from there.
Okay.
All right. Well, thank you.
You're welcome.
Thank you for calling, Cindy. Now, a lot of people out there probably don't have hearing problems. What are some common sense things we can do to keep our hearing healthy? You sort of mentioned protecting from noise. Anything else?
Yeah, I mean, absolutely. Overall body health, the healthier your body is, the healthier your ears will be. Blood pressure, keep it under control. Diabetes, keep it under control. Noise exposure, you know, you don't think about the small things in your life every day. Leaf blowers, lawnmowers, simple things like that. They add up over time, the exposure to that noise. So get some cheap, inexpensive earplugs, put them in.
Okay. Now, what about everyone's walking around with iPods and cell phones?
Right.
Does that hurt or help the ears?
Yeah, it's probably not helping the ears, but you can use them safely with an iPod. If it is the Apple iPod brand, a good rule of thumb is if the dial, when you see the volume on the dial, if it's all the way up, that's probably 100 dB, and that's doing damage immediately. So if you'll roll that down to about 3/4 of the way, that's about 75 dB, very safe. You could listen to it there for 8 hours. So especially if you have a teenager, look at the dial. If it's about 3/4 of the way, they're safe.
Okay, well that is very good information. Everyone is interested in wax. We talked a little bit about wax.
Right.
We talked about the softener. How are some safe ways to remove wax from the ear? Now, I use this Q-tip thing, and someone told me that's not a good idea. I shouldn't use a Q-tip.
I don't recommend you putting anything in your ear at all. Okay. If you use a Q-tip on the outside of the ear, that's fine. It does not need to go into the ear canal. Typically, if you have wax in your ear and you put in a Q-tip, you're pushing it in a little further. Okay. And folks come in and they push the wax in down next to the drum, and it makes it hard to remove. So really, let nature take its course. It should work its way out. Okay. If not, it's safe to use a little syringe with a little water. Okay. Have it be really close to your body temperature, because if it's too warm or too cold, it may make you feel a little dizzy. Rinse your ear out, that's safe. In the shower, rinse it out. Okay. However, you want to be careful that you don't have a hole in your eardrum for some reason, but you would know if you did. But don't use a Q-tip, let nature take its course. You can rinse it with a little water.
Now, what do you think of the water picks?
I think it can be safe.
Okay.
Have the water, again, be really close to your body temperature. Folks use it a lot. There are physicians who still use that in their office. Okay. I think it can be safe.
Yeah, that's what I think I'm going to give up the Q-tips.
Okay, good.
But occasionally I get some stuff out, I'll tell you.
I know, I know.
It started back in childhood, Wendy, because I used to put sticks in my ears too sometimes. Okay. That wasn't a smart thing to do.
We'll talk later.
Yeah, I don't know. I shouldn't say that on the air. But you still have a chance to give us a call. We still got another section left. We're 855-644-3278. And we're going to go to our website for another question. And this question is again about hearing aids. We have a lot of questions about that. I guess because that's sort of a common treatment. She says, I bought my hearing aid off an ad from television and it doesn't seem to be helping me. I went back to the medical team but did not get help. What should I do next? You know, I can see why. They go to the medical team, listen, you bought it from the TV.
Right.
I don't think that was a good idea.
Well, first, I'm just going to have to make a couple of guesses that the hearing aid that you bought from the TV is probably just a real low level technology. It's probably just an amplifier. Okay. So it'll make soft sounds louder, but that's it. If your hearing loss is worse for, let's say, high frequency sounds, but normal for low frequency sounds, it's going to amplify those low frequency sounds, and you don't need that. It doesn't clear up the sound for you. What you need is to be evaluated by an audiologist, get a good hearing test, get a good recommendation.
Now, the hearing aids have all sorts of technology now. I mean, I've seen some of them you can't even see. You put them behind the ears.
Right.
They're very, you can't even see them
Right.
anymore.
I mean, basically, a hearing aid now is a little computer. It's a little digital chip, really small. The technology's great. Bluetooth in hearing aids.
Wow.
They're an easy answer.
Now, they're expensive though, some of them, right?
Some hearing aids are expensive. Again, you're paying for the technology.
Now, does Medicare pay for that?
Medicare will pay for an evaluation on a
Okay.
referral from your physician, but they will not pay for hearing aids.
They won't pay for hearing aids, but something that's very important, like your eyes, your ears, very important to interact with the world. So you can still get a hold of us. We have some time left. Give us a call, 855-644-3278. Or if you're interested in our ministry, we invite you to our webpage. It's heartwiseministries.org. And we love to have friends on Facebook. So join us on Facebook and you can keep track of everything we're doing. We're so glad that Dr. Halsey-Richardson has given her time with us today. Go get a glass of water. We're going to be back answering some more questions, talking about your ear and hearing when we come back on Heart of Health Live.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
I'd like to think that one day, when we get to heaven, we're going to see a list of people. People like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
I have learned so much about ears and hearing to this evening, and I hope you have too. And you know, one of the things I've learned is not to stick the Q-tip and sticks in the ears. Not good. I could puncture my eardrum too, I guess, if I pushed it into, and that's happened a couple times. I push things in too far and I get that funny feeling. We have 3 more questions that we're going to answer here. We're going to try to go quickly. This person that's called in has lots of itching in their ears. Any recommendations for itchy ears?
Yeah, I mean, try to find out what's causing the itching. Usually it's dry ears.
Okay.
Your ears are dry. Again, before you put anything in your ear, I would want someone to look in the ear canal, make sure it looks healthy. If it looks healthy but just dry, you can use a little oil in the ear, very little, put a little on your pinky, rub it on the outside. What's a good oil? Olive oil's great.
Okay. Can allergies cause itchy ears?
Yes,
Okay.
allergies are one of the #1 causes of itchy ears.
No, because itchy eyes, itchy ears,
Right.
itchy everything. We have one from Colleen in Michigan, and Colleen says, my oldest son, I guess when he was younger, had continuous ear infections.
Right.
And she wants to know if there might be a link between ear infections and childhood immunizations.
You know, I haven't read in the literature about a link between immunizations and more ear infections than normal.
Yeah. I mean, that's something, if you read on the internet, you're going to hear just about everything, and everyone's suspicious. And, you know, anything you put in your body, you have to, all this stuff can have chemical reactions. Wow, we've covered a lot of topics. I saw some of our callers dropped off the line here. I guess they're realizing we're in our last section. I got some facts that I don't know if they're true or not. I wanted to run by you, see if you think this is true. And I think we've answered some of these. Is listening to an MP3 player at high volumes, can that cause permanent damage to hearing?
Absolutely. If you're above 85 dB,
okay,
you're doing damage.
Okay. Is this true or false? This says a hearing loss can cause a child to miss as much as 50% of classroom discussion.
Well, yeah, absolutely.
Okay.
It depends. Again, it's going to depend on the degree of hearing loss. Classrooms are not good hearing areas typically. There's lots of noise going on, little feet shuffling, pencil sharpeners, so any hearing loss can be educationally significant to a child.
Now, this is a true statement because I've heard this before. It says exposure to a noisy subway for just 15 minutes a day over time can cause permanent damages over time.
You know, I would have to find out how loud the subway is.
Okay.
But if it's around 100 dB or louder, which I'm sure it is, that could be a true statement.
So Wendy, if you wanted to leave some parting comments today to all the people about their hearing and their ears, and what would you want to say here?
Yeah, with hearing loss, think about your quality of life. Don't be embarrassed to get your hearing tested. Go in, get a baseline, see if you have some loss. If you don't, great. If you do, don't be afraid to treat it. Okay.
So, you know, we're glad to have Dr. Wendy Halsey-Richardson with us, and she can be reached at her website, which is ChattanoogaHealthyHearing.com, and you can also, we'll throw up her phone number. We're just glad that you heard this program today. If you didn't hear it, you know, we're going to work on closed captioning in the future. But we want to thank you for joining us, and you can be a part of our ministry every week. Go to our website, heartwiseministries.org. Become one of our Facebook friends. We want to let you know that no matter what's happening in your life, there's a place for modern medicine. There's a place where God can work with you and change your habits, like coming to see someone help your hearing. But we want you to stay in that relationship with Him so you can have permanent healing. Thank you for joining us. Join us each week at this time. And we want to also thank you, Dr. Halsey-Richardson, for joining us. Thank you. Until next time, I'm Dr. James Markham, wishing you the best in hearing.